Okay, so hi guys, my name is Hannah Warner, and today I'll be presenting on the impact of omega-3 fatty acids on cardiovascular risk. So, cardiovascular disease impacts roughly 17.7 million people yearly, and cardiovascular diseases are known as disorders of the heart and blood vessels. They frequently include cerebrovascular disease, coronary heart disease, peripheral arterial disease, and pulmonary embolism. They also include rheumatic and congenital heart disease. By 2030, it is predicted that 40.5% of all US adults will be affected by CVD, and the total projected cost for CVD management and treatment, including direct and indirect costs, exceeds $1 trillion. So, what are omega 3 fatty acids? Omega 3 fatty acids are also known as essential polyunsaturated fatty acids, or PUFAs. PUFAs consist of a long chain of carbon atoms, and they have a carboxyl group at one end and a methyl group on the other. So ALA and linoleic acid are essentially the derivative of EPA and DHA. ALA is converted into EPA and DHA, but the conversion factor, which primarily occurs in the liver, is very limited. It has reported rates of less than 15%. So it's important for people to consume EPA and DHA directly from their diets. This can be from food or from dietary supplements, um, just to increase the level of these fatty acids in their body. So, omega 3s are also commonly referred to as N3s when you are analyzing certain research studies. And they are present in foods such as flaxseed. They're really high in fish or fish oils. So, composition of the Western diet. So, the Western diet is a typical contributor to many diseases. In this particular instance, we are talking about the development of cardiovascular diseases. This is typically contributed to many developed societies consuming a diet higher in omega 6s rather than omega 3s. So you have a larger consumption of vegetable oils rather than certain fish oils. Um, and you notice that the intake of fish and fatty fish is high in some countries, including Japan, but is low in many westernized countries, including the United States and the United Kingdom. As a result of this, the EPA and DHA among adults varies among these populations, and it's considered that many non-fatty fish eaters have a intake of less than zero point 0.2 grams per day in many of these westernized countries. So extensive research has been conducted over the past 40 years regarding omega-3s and their protective properties on human health. The consumption of essential omega-3 fatty acids has been shown to have many anti-inflammatory, anti-arrhythmic, and anti-thrombotic effects. They've been shown to reduce specific inflammatory markers, including cytokine, C-reactive protein, or tumor necrosis factor. They do so by various mechanisms, and these include the modulation of cellular function, through changes in gene expression. So these changes in gene expression frequently occur by the binding and subsequent activation of peroxisome proliferator activated receptors, otherwise known as PPARs. So activation of these nuclear receptors are known to up and down regulate the expression of genes involved in lipid metabolism and inflammation, respectively. These omega 3s also act as natural ligands, which is a additional factor in reducing inflammation in the body. So, not only do omega 3s reduce inflammatory markers, but they also decrease. They also work to decrease serum triglyceride concentrations. They do so by reducing the number of triglyceride transporting lipoproteins, and this is secondary to reduced hepatic very low density lipoprotein cholesterol production. Omega 3s have also been shown to lower resting heart rate and blood pressure as well. They do so by reducing systemic vascular resistance and by improving flow mediated vasodilation. So, one of the first studies kind of noticing the correlation between omega 3 fatty acids and cardiovascular health was within the Greenland Inuit population. This kind of idea originated, while the idea correlating omega 3 fatty acids and cardiovascular health originally derived from the 1940s, and it was thought that marine omega 3s were suggested to provide cardiovascular benefits. So, this idea began when a researcher called Erstorm discovered that the Greenland Inuit population had approximately one third the amount of myocardial infarction compared to the general population in Finland. And it was noted that their diets were very high in marine omega 3 fatty acids, and these primarily consisted of whale, seal meat, and blubber. It was noted when they studied this population that there were very favorable changes in their lipid and lipoprotein profiles, along with reduced platelet reactivity. So later on, this study kind of propelled further studies to notice that higher intakes of marine omega 3s had a lower instance of cardiovascular disease rate. So this study hence propelled further interest into the studying of omega 3s and their impact on CVD. And this has been continuing onward for around 40 to 50 years. So, one of the other larger scale clinical trials regarding omega 3 fatty acid consumption and mortality risk was called the 7 country study. And this study was conducted by Ansel Keys. This study was hypothesized to analyze the rate of coronary artery disease in populations and individuals. And his hypothesis was that this rate would vary depending on relation to physical characteristics and lifestyle, particularly in fat composition of the diet and serum cholesterol levels. So the 7 countries that he analyzed included Finland, Yugoslovakia, Italy, Greece, Japan, the Netherlands, and the United States. He analyzed primarily middle-aged men. And he found that mortality from ischemic heart disease was lower in Japan and Mediterranean countries than it was in the United States and Northern European countries. So this study really highlighted the role of unsaturated fatty acids that are frequently abundant in Japanese and Mediterranean diets, and the benefits that they can have on certain cardiovascular effects. This was considered a profound landmark study, and it has been extensively researched in the large-scale epidemiological studies, clinical outcome trials, and meta-analyses. And it kind of showed a correlation between not only healthy lifestyle, but particularly diet and its effects on cardiovascular disease. So an additional trial that was huge in the research end of omega 3s was the Japan EPA lipid intervention, or JELIS study. This produced similar results in the reduction of CVD in a certain population, this population being Japanese patients. It included 18,645 patients, and it analyzed primary and secondary prevention of coronary heart disease. It did so by analyzing the consumption of omega 3 fatty acids and also additional supplementation of these. In this instance, they provided a high dosage of EPA. They provided 1,800 milligrams daily, either distributed with a statin or with a statin only. And then they analyzed these patients after a 5-year follow-up. The primary endpoints that were analyzed included any major coronary event, which included sudden cardiac death, fatal and non-fatal myocardial infarction, and other non-fatal events, including unstable angina pectoris, angioplasty, stunting, or coronary artery bypass grafting. So this study found that there was a 19% reduction in CVD risk, and most of these reductions were in unstable angina and non-fatal coronary events, but not in sudden death or cardiovascular mortality. So, this evidence suggested particularly greater benefits with omega 3 fatty acid consumption in secondary prevention rather than in primary prevention, or in populations that were consuming low amounts of omega 3 fatty acids. So, despite increasing evidence that omega 3 fatty acids have beneficial effects on cardiovascular disease risk, certain randomized controlled trials have produced varying effects. This particular study included type 2 diabetic patients, along with those who had already developed atherosclerosis. Um, these patients received optimal medical therapy along with omega 3 fatty acid supplementation. This was a 3-month trial, and they received around 2 grams of omega 3 fatty acids distributed through EPA and DHA daily. These results, however, showed that there were no significant changes in triglycerides, total cholesterol, LDL-C, or HDL-C in these patients. Additionally, there was no changes in the hemoglobin A1C levels or the peptide C levels of these patients. A limitation of this study, though, mentioned that this could be possibly due to the high level of metabolic dysregulation that was occurring in these patients due to already established type 2 diabetes, or high levels of obesity. So, therefore, this short span of supplementation of 3 months potentially did not have, or it wasn't potent enough to improve the endocrine activity of this fat tissue in patients, consequently, having little impact on CVD risk. So, similarly, another study conducted in patients following myocardial infarction found that low supplementation with omega 3 fatty acids did not produce a significant change in CVD risk. So, in this particular study, 4,837 patients were recruited. They were both men and women, 60 to 80 years of age. Um, and they were clinically diagnosed with myocardial infarction up to 10 years prior to randomization. So these men and women had supplementation with 4 different kinds of margarines. So the first margarine was considered the placebo margarine. It had no omega 3 fatty acids added to it. The second one had around 400 milligrams of EPA and DHA. The third had 2 grams of ALA, and the fourth had a combination of EPA, DHA, and ALA. It was concluded that an additional daily intake of an average of 376 milligrams of EPA and DHA, or 1.9 grams of ALA daily, did not significantly reduce the rate of any major core cardiovascular event in these patients who had prior myocardial infarction. They were also receiving state of the art antihypertensive, antithrombotic, and lipid modifying therapy. Despite this, there were no significant changes noted in their supplementation. So, just to conclude, despite existing evidence from multiple meta analyses and trials that support the recommendation of supplementation of omega 3 fatty acids for cardiovascular health, there are still trials, especially randomized controlled trials in those with already established disease states, that have been producing kind of contradicting results. So, I would say to conclude this that there should be more studies done in patients with already existing CVD, diabetes, metabolic syndrome, etc., in order to provide a fully comprehensive view of the effects of omega 3 fatty acid supplementation, not only in those for primary prevention, but for those looking for secondary prevention. So that is all I have. Thank you for your time, and I hope you enjoyed this presentation.